I want to ask you about the role of stem cell in treating a cancer patient. At NIMS, what do you guys do? Can you explain the process?
Yes, sir. Actually, the stem cell transplant is a very good technology now. So basically, stem cells means some people they'll think that nowadays everybody they are using some stem cell can be used anywhere. That will transform to different types of cells. It is not possible at this point of time. Especially this approved technology, proved science in bone marrow transplantation. That's known as stem cell transplantation. Usually, this we broadly will divide them into 2 or 3 categories. Autologous stem cells. Autologous means we'll collect the stem cells of the same individual, keep it aside, and we'll give the chemotherapy that will kill the cancerous cells. And during that time, I think they may damage the normal tissue also. Just again, the same cells will reinfuse to the same patient. So they'll engraft after some time. It is known as autologous transplantation. This transplantation we usually will use in multiple myeloma and some many refractory and relapsed lymphomas. There are specific indications are there for this one. And coming to the blood cancers, because all the stem cells are diseased ones or genetically modified ones. So what we do, just we'll collect their sibling stem cells. Usually sibling means as a brother or sister. Or sometimes haploidentical, either mother, father also we can collect the same stem cells. If these two are not possible, sometimes we'll go for something like a matched unrelated donors. There is a one Datri in India. Just we'll submit the HLA typing to them. They'll search in their website and they have their own list. So they'll try to find out the matched donor. That is known as a matched unrelated donor. Not related to our family. So it's not a mud. So again, those stem cells, what we'll use in refractory leukemias. For example, blood cancer is a genetic disorder, sometimes chromosomal abnormality. We can't use the same person's stem cells. We have to use a different person's stem cells. So we'll collect the stem cells, preserve, and we'll give the high dose chemotherapy. So these stem cells will go and stay in the bone marrow. That is known as engraftment after 1 to 10 days. Then again they'll start growing and they'll start producing the WBC, hemoglobin, RBC and platelets. It takes some time. During that time they may get infections. So for that sake, I think we have to create a very specific environment. That environment is the HEPA filters, we'll say that one. Each room contains something good HEPA filters which will filter the virus, dust and bacteria. So in NIMS also we have around 8 suites are there. At a given point of time we can do 8 transplants. At a given point of time. At this point of time we have 7 patients in our ward now. So all are just we are doing autologous, allogenic also we are doing, and all these transplants also again the principle is just trying to cure the cancer. So not for just only to give some palliation. So luckily the state government of Telangana and Andhra, we have these facilities under Aarogyasri program. So
even for stem cells?
Yes. We can treat all these patients at free of cost. So the great thing about Telangana, Andhra, at least our politicians or policymakers, they're very intuitive. They wanted to listen whatever we say because the good centers are there. Our intention is very good, so they are supporting us in that way. We are doing many transplants, and once upon a time, hardly we do 10 to 20 per annum. Now, just we are doing 50 to 60 per annum now. Maybe that number may
just
increase.
At NIMS?
At NIMS itself. That number may increase. I said 8 rooms per at a given point of time. And 8 usually can is up to 100 we can do in per annum now. So at free of cost, I think all the central government employees, poor people, they can get this treatment at free of cost in NIMS. We have that facility. And the principle is again, the patient has to be there for 1 month. But there's only one thing, I think the whole family should prepare that. They have to stay in that room for at least 2 to 3 weeks to avoid all the infections and something.
Because you said HEPA filters.
Yeah, that's the thing. So only thing is, I think again, as you said, we have to counsel the patient for all angles because the family, kids, maybe they're at home. They have to prepare everything now. So I think, but the treatment, whatever we are giving in our center or in Hyderabad, same treatment you can get in UK and Europe. Same treatment you will get in our, you can say America also. But maybe the different scenarios. But all the diagnostic modalities, especially this imaging, I said something PET scan and all the PET scans. and molecular test,
Hmm.
especially NGS, next generation sequencing.
Hmm.
The people
Hmm.
they'll say they'll sequence the whole gene
Hmm.
and they'll find out where is abnormality.
Wow.
That test also available in India now,
Hmm.
and we are able to find out. And we are able to get the drugs also. For example, any drug which is approved by the FDA
Hmm.
or EMA in
Hmm.
Europe, and within I think 1 or 2 months we are able to get the drug. At least we can import it initially,
Correct.
but later
Later
our
on.
government and will give the permission for DCGI, that will give the permission. Then we can
Develop.
they can market the drug in India. So I think almost I think we are on par with any other developed country.
Excellent.
We are able to get the all modalities from diagnosis,
Hmm.
treatment, and post treatment. I think
Yes.
for the follow up also, what you
Hmm.
said is only thing is because some especially in Indian context, some people they'll say once the treatment is over, they think that everything is over.
Hmm.
But no, it's not
Hmm.
right actually. They have to come to hospital every 3 months, first
Hmm.
2 years.
Yes.
There is only one I think lacune we have.
Hmm.
We have in our center.
Hmm.
We don't have a strict follow up to take care of this patient. We every third month we have to call the patient. Because we don't have that system to remind them come.
Hmm. Correct.
Only thing is the patient they has to take their own interest and they have to come regularly. So, but we'll counsel them usually. 90% of people they'll come regularly
Sure.
to the, because again the post treatment follow up is most important,
Hmm.
especially any side effects
Hmm.
because of our therapy,
Hmm.
or there is a possibility of recurrence and relapse in the future also.
Hmm.
So if you detect that relapse at early stage, again we can cure the problem.